Good afternoon, everybody, and thank you for your attendance. It is a pleasure to be here this afternoon to talk about the importance of supportive care for people living with melanoma. Firstly, my name is Brooke Kelly. I live in Victoria, and I'm an experienced oncology nurse who joined MPA's team months ago as their National Melanoma Telehealth Nurse. The Melanoma Telehealth Nurse is a free service and it's available on a Monday, Tuesday and Thursday during business hours and is available to anybody touched by melanoma, including patients, family members and carers. The role is also generously funded by the Melanoma Institute of Australia. What is the role of a melanoma telehealth nurse? To provide practical tips and emotional support, educate patients, families and carers about their cancer journey and what to expect, to assist with referrals to other necessary agencies and liaise with other health professionals, assess potential side effects and provide relevant guidance to manage these, support distressed families and patients, and provide helpful suggestions to assist. We also help with bereavement support. How to contact the Melanoma Telehealth Nurse. People can self-refer by emailing brooke@melanomapatients.org.au. Patients and families can also call Brooke directly on 0413 868 197. Patients and families could also call the MPA helpline on 1300 884 450 and ask the team of volunteers to refer you directly to the Melanoma Telehealth Service. MPA services available. We have our National Melanoma Support Line, our monthly virtual support group, face-to-face support groups, telephone support groups, closed Facebook support group, peer-to-peer support, carer support, and our patient information forums. All this information can be found on our website, which is listed in our resource section on this presentation. What is supportive care? Supportive care in cancer is an umbrella term to describe the services that may be required by those affected by cancer. It includes self-help and support, information, psychological input, symptom control, social aid, rehabilitation, spiritual assistance, palliative care, and bereavement care. Supportive care in cancer refers to the following 5 domains: physical needs, psychological needs, social needs, information needs, spiritual needs. All members of a multidisciplinary team have a role to play in providing supportive care. In addition, support from family, friends, support groups, volunteers, and other community-based organisations can make a really important contribution to the supportive care. Who provides supportive care? Alongside oncology nurses, allied health professionals involved in supportive care for cancer can include dietitians, lymphedema practitioners, music and art therapists, occupational therapists, pastoral care workers, psychiatrists, psychologists, social workers, speech and language therapists, and in addition, the support from family, friends, support group, volunteers, and other community organisations can all make a big difference. What are the benefits of the supportive care for melanoma patients? Cancer Australia has found that many positive outcomes for patients can include the following: increased survival for patients, shorter timeframes from diagnosis to treatment, greater likelihood of receiving care in accord with clinical practice guidelines, including psychological support and psychosocial support, increased access to information, improved satisfaction with treatment and care, and improved quality of life for patients. What are the benefits for health professionals? Cancer Australia has found that there are benefits to the health professionals when patients have appropriate supportive care in place. These include the following: improve patient care and outcomes through the development of an agreed treatment plan, streamline treatment pathways and reduction in duplication of services, improve coordination of care, and educational opportunities for health professionals, as well as improved mental health care and needs of the health professionals. How can patients and families access supportive care? You can simply talk to your medical oncologist, your GP, or your oncology nurse about the types of supports that you require, as they can assist you directly with the referrals needed. Melanoma patients can also talk with their treating GPs about accessing a chronic disease management plan, which will entitle them to up to 5 Medicare visits through the calendar year. Melanoma patients experiencing issues or concerns about their mental well-being may be eligible to also access a mental health care plan, which you can get appropriate care and support. Medicare rebates up to 20 sessions using the Medicare system and accessing a mental health care plan. This can also be discussed with your GP or your treating oncologist. What are some other ways to improve your physical and emotional health needs? We understand that due to the current situation with the COVID pandemic, that people's lives have been greatly disrupted. And we are also aware that there are some great wait lists to see specialists such as psychologists and other health professionals. So here are some really helpful practical tips that may help you improve your current situation from home. You can practice self-care, such as daily walk, or enjoy a weekly bath. Practice mindfulness or meditation. Participate in an online exercise class. Write in a journal. Join a support group. Connect with friends. Take up a new hobby. All these things can greatly help, and we understand they're an individual thing. So giving some of these a go may just make a big difference to your current situation. Here is a list of our resources and supports. And I'm really happy for participating in today's conference, and I'm happy to take any questions in our Q&A session. Thanks again, everybody.